If we could get started, guys. Dr. Lee, Geronimo, manager, we're gonna get started. Okay. Dr. Martin,
Hi, Ann.
yeah, and
Hey.
Dr. Brinson, I think, is on. Dr. Brinson, can you hear us? Can she hear us? Do you know? Okay. I will be chairing the Strategic Planning Committee meeting today. Dr. Brinson will be on virtually as she can to participate. So,
Yes, I can hear everybody. I'm sorry. I couldn't
okay,
get
no
my.
problem. That's great. Okay, good afternoon. Today is May 14th, and it is 2:35. As a quorum of the committee is in attendance, I'd like to call to order the meeting of the Central Health Strategic Planning Committee. As I mentioned before, committee member may also be participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. So we have Dr. Brinson and Dr. Martin that are on video. So we'll now receive public communication for the Strategic Planning Committee, Budget and Finance, and Board of Managers meetings. Do we have any no? Okay, we have no public comments at this point, so we'll now proceed to the committee agenda. Our first item is to receive an update on the collaboration between Central Health, the City of Austin, Travis County, and Ending Community Homelessness Coalition, ECHO, to identify investments and services for people experiencing homelessness. And I believe we have Monica Crowley and John Morgan will be presenting. Managers, this is an informational item for us today.
Thank you, Chair Kitchen. Monica Crowley, Chief Strategy Officer. And thank you. Next slide, please. Thank you for giving us this opportunity to update you on our work regarding investments in people experiencing homelessness, including work that we're doing with ECHO and the City of Austin Homeless Strategy Office and the homeless and the Travis County and ECHO and Integral Care. A focus on healthcare services for people experiencing homelessness has long been a priority for Central Health. And one of the ways this has been our definition of who is counted as homeless for MAP-H has always been broader than the definition of people who are experiencing chronic and persistent homelessness. We've worked on creating point of care application opportunities for people experiencing homelessness, including attestation, so that we reduce barriers to eligibility and enrollment in MAP-H. We've long funded street and mobile services with community care and provided care at the Arch downtown. As we conducted the Community Health Needs Assessment, Voice of the Community, and developed the Healthcare Equity Plan, that resulted in the adoption of the 7-year Healthcare Equity Implementation Plan in August of 23 by the Central Health Board. This focus on services for people experiencing homelessness expanded. Next slide, please. And if you look, this slide depicts all of the areas of community need and high-level key initiatives that were adopted by the Central Health Board in the Healthcare Equity Plan. The areas that focus on people experiencing homelessness are highlighted and include access to mental health services, robust post-acute care, including respite care and extensivist services, which you guys might have heard referred to as CareCo. The substance use treatment and addiction medicine services, specific services related to healthcare for the homeless, expansions of enrollment eligibility services, including things like SOAR applications, which provide expedited ways for people experiencing homelessness and with certain chronic conditions to get on Social Security disability and qualify for other coverage programs, and a focus on social determinants of health. And Dr. Shalsha is going to go through some of the specific initiatives that we currently have underway in response to addressing these needs for our unhoused neighbors. Next slide, please.
All right, thank you, Monica. Good afternoon, managers. As Monica shared, I'm going to run through in a little greater detail some of the contracted services for individuals who are unhoused and direct practice initiatives that we as Central Health have invested in. First of all, for hospital services, specialty hospital services and emergency services through the Master Services Agreement and the Omnibus Agreement, Central Health has invested significantly in healthcare or in homeless healthcare due to long specialty wait lists and continued unmet need. You all supported the expansion and the establishment of specialty services from cardiology to pulmonology to nephrology, palliative care, et cetera. We've established those service lines, and obviously every service line we establish provides care for individuals who are unhoused. Not only do we provide that care, but we provide the wraparound care, so case management and other collaborative care services that prevent the unhoused from falling through gaps in care. A little over a year ago, we started working with Travis County Jail and the sheriff and her team to provide specialty care access for justice-involved individuals. Currently, service lines that have been utilized within our specialty environment: nephrology, palliative care, podiatry, and then various imaging opportunities. To date, 32 justice-involved individuals have been transported on-site to our clinics to receive that care. There have actually been, I think, about 62 referrals that have been made, but individuals have been released prior to their opportunity to be seen within our clinic. We are now working with our Travis County partners for remote care for all of our areas, our specialty areas. 10 to 15% of our patient population are unhoused, and so throughout the system, whether it's primary care, behavioral health, dental services, all of those environments, including within our system partners, CUC, offer care to the unhoused. We also provide prescription resources to those individuals experiencing homelessness, including those prescriptions that don't sit within 340B, where we have to complete assistance program paperwork to attain those meds for those patients. Thank you to the board's support. We were able to establish respite care. About 2 years ago, we started with 5 beds. We expanded to 25 beds. As you all know, within the summer, we're going to open the CEC and add an additional 40 to 50 respite beds. The majority of the individuals who utilize those services are those who are unhoused. In addition to the respite beds, there'll be clinic services and mental health services that will also open in the CUC and cater to that patient population. I'm going to talk a little bit more to skilled nursing facilities a little bit later, but we provide our own direct care within skilled nursing facilities to individuals who are unhoused. Right now, we're at 3 skilled nursing facilities. Maintain a census of between 30 and 40 individuals, and we contract for additional care for individuals who are unhoused. We contract for hospice services, and we also have palliative care services that sit within our specialty care. So when we're thinking about that care continuum as individuals who are unhoused progress in their disease process, we're actually able to help support them as their disease process advances. Monica spoke about the Care Connections Clinic. That clinic was actually a clinic that we advocated for. I think when I sat as Chief Medical Officer within community care, that was 8 years ago. It was a year into my tenure. That clinic is a complex care clinic. that really serves as a continuity clinic for the unhoused, where there are wrap services from case management, pharmaceutical care, dietitians, psychiatric care. I think the advocacy 8 years ago was $1.3 million to provide that care. And so obviously 8 years later, the care is, that cost has advanced significantly. Again, thanks to you all in the advocacy and your advocacy, we're able to open our Bridge clinic and mobile teams, really addressing transitional care, specifically for individuals who are unhoused. Within our Bridge clinic, we care for those in our respite program. We also partner with EMS and triage in real time, and so EMS patients or unhoused patients who don't necessarily need to be taken to the emergency department are brought to our Bridge clinic. We also receive patients from Northbridge, Southbridge, from foundation communities. Our mobile team provides care. I think the first shelter that we were able to provide care was the 8th Street Women's Shelter. We also provide care within kind of the collaborative diversion program, where individuals with behavioral health diagnoses, many of whom are unhoused, reside within that 15th Street Integral Care Site for up to 90 days, and we provide the physical health care within that environment. Permanent supportive housing, these are opportunities for individuals who were previously unhoused. I think there are about 70 units that are currently up and running. We have one team that is providing care at two environments or two sites. There are an additional about 470 units that will become available over the next year, and so a much greater need up and coming. As far as transitions of care, we have placed individuals both in the hospital, in the emergency room, and in the emergency room in order to facilitate enrolling people in MAP coverage, or ensuring that they don't fall out of MAP coverage, and ensuring that they have a plan of care and transition smoothly from those care environments either to home, to SNF, to respite, or to care at home. Monica spoke to the fact that we've been able to advance and add resources for enrollment or to enroll folks. So we've added sites for eligibility workers, and that is Cesar Chavez serves at that as one of those sites, as does the Sunrise Church. Our teams have actually been incredibly successful as far as completing SOAR applications, which increases our opportunity to get individuals housed. We also facilitate transportation for unhoused individuals, and that's to and from any clinic appointment. That's to and from skilled nursing facilities, and for any social services that are needed in order to support their clinical care. For our individuals with addiction disorder, I think we've been contracting with Integral Care and Community Care for between 7 and 8 years, and on an annual basis, access to Suboxone and Methadone has increased. We've also contracted with external providers to make sure that opportunity continues to advance. We're also working with the jail to ensure that individuals who have an addiction disorder and sit within the county jail have continued access to meds. Our partnership with Integral Care continues to advance, both for outpatient services, psychiatric emergency services, and addiction services. I think over the past year, we ensured that those psychiatric emergency services were available 24 hours a day, to where there was a prescriber on at all times. And Integral Care even now has a mobile vehicle that is able to cater to individuals who are unhoused and meet their mental health needs. Over the past 8 to 10 months, We've distributed 1,800 naloxone units throughout our communities, and this is to various shelters and to system partners. And obviously, the hope there is that we prevent overdoses. I've touched on the diversion services and the emergency psychiatric services. Our partnership with Sobering Center continues to advance. We have contracted for holdover beds and are currently in discussion with the Sobering Center to advance opportunities for our shared patients. We fund we contract with EMS for their C4 services, for community health paramedics, and for street inductions of Suboxone, and that partnership is advancing as well. I've touched on many of the facilities that sit, to the right of that slide. Hancock is obviously, it's about 100,000 square feet of clinical space that will house David Powell, convenient care, pharmaceutical, and specialty services. All of those will be available to serve those who are unhoused. Cameron Center currently consists of three different buildings. We will continue to expand our respite bed count, as well as offer clinical services and addiction services within that environment. It also serves as an opportunity to partner more with the city for case management and navigation services for the unhoused. And actually, we're looking to give that a kickstart and looking at this CEC as kind of an opportunity to explore kind of a pilot program with our city partners where we can help jointly work on navigation of our unhoused and on collaborative case management opportunities. Anywhere where we have specialty services, so Capitol Plaza, East, and Rosewood Zaragoza are all environments that we either had a significant or a small build out that provide needed services to the unhoused, and we currently have funded either through community care or directly through our bridge program vehicles that provide and through Integral Care that provide either medical care or behavioral health care to individuals who are unhoused. We're also looking at prescription supply opportunities through vans and potentially in this upcoming year, transportation of our patients. And we'll share a little bit more later why I think we can gain some efficiencies if we actually are able to transport our patients from clinical site to clinical site and facilitate their needs. And I will hand this off to Mr. Morgan.
Thank you, sir. Good afternoon, managers. So as we enter the FY26 budget season, we really wanted to try to tie the initiatives of the health equity plan and the community health needs assessment from a few years ago to the initiatives and the services that have really been the execution of those identified needs in the service delivery strategic plan, and then to try and tie that to the dollars in the budget and the investments that Central Health's making on an ongoing basis. So I'm going to talk through just two financial slides that aim to put some dollars to the initiatives over the past 3 years, so the past 3 fiscal years, including this current fiscal year, as well as just a snapshot of what we think that estimate is for the current year, just to, again, give you some more context going into the budget season of where these investments are being made. On the far left-hand side are the investment types, so either operating or capital dollars or a combination of the two. The first item here are the contracted services with Integral Care that Alan mentioned. We estimate that approximately 20% of the total investment that we're making with Integral Care is serving individuals experiencing homelessness, although we believe that more of the crisis-oriented services are as much as 90% individuals experiencing homelessness. The second area, the transitions of care teams that are working in the hospital, caring for our patients in direct practice in our skilled nursing facilities, and following patients post-discharge, and case management teams. So that's the $11.6 million over the past 3 years, and $8.3 million just in FY '25. Medical respite, the first line is the contracted the contracted beds that Dr. Shalsha mentioned, the 25 beds that we have today, as well as the clinical teams that are providing the medical support services for those individuals. The second medical respite line, the build, is the renovation of the CEC, the operating dollars associated with that facility, and the build out for the longer term Cameron Road facility. So the $19.5 million includes some of that capital expense, which is why it's lower in the FY '25 than it was in the prior period. Diversion services, this is the collaboration with Integral Care as well as the Sobering Center at the 15th Street Diversion Center program with Integral Care. This does not include the mobile teams that are going to that facility. This is the direct support of the psychiatric emergency services. If you recall, the board invested in enhancing the service at PES to be a 24-hour operation, to have on-site prescriber access 24 hours a day, and to develop the capability for 23-hour observation. So that's been a big part of what also helps support the diversion services at 15th Street. The bridge teams, this is us, this is community care, EMS, the permanent supportive housing facilities that Dr. Shalsha mentioned, as well as our outreach contract through the Hungry Hill Foundation. A lot of work going on in that space and still a lot of needs in that space. The capital component are the vehicles that our teams are using to provide that mobile medicine. Naloxone distribution, this is both the cost of the naloxone drugs that are being distributed, as well as the indoor and outdoor units that we're placing at Central Health and community care locations and at partner locations such as shelters and some of our nonprofit partners' offices. MAT and methadone services, again, this is Integral Care, community care, community medical services, and Oshbach and Associates for both methadone and Suboxone. And then our enrollment teams that are just the slice that are specifically dedicated to targeting enrollment for individuals experiencing homelessness. It's walk-in access at Southeast Health and Wellness, here at Cesar Chavez, teams that go to Sunrise Church, and our SOAR specialists that help individuals across the system. The only other thing I'd point out on this slide is just that the FY '25 estimate is in almost every case half or more than the 3-year estimate, which is really an indication that these are recent enhancements and investments in each of these service areas that are continuing to grow. Next slide, please. This second slide is an attempt to give you kind of an overall estimate of the investment that Central Health is making into services for individuals experiencing homelessness, our patients. And as mentioned at the beginning, this represents 10 to 15% of our patient population, so about 11,000 individuals enrolled in our program on an annual basis. The first line is the portion of our entire healthcare delivery operating budget that we're able to attribute in a large, high-level estimate to individuals experiencing homelessness, inclusive of those service provider partner agreements that I mentioned, as well as our direct services here at Central Health. So that's kind of an aggregate number out of the Central Health budget, both over the 3-year period and the $35 million related to this year. And then the second line is our estimate associated with the Central Health Ascension Master Agreement and Omnibus Services Agreement. So the hospital, specialty care, and emergency department services that our Ascension partners provide us. If you'd go to the next slide. This is just a preview of some of the types of initiatives that are already largely in motion this year and that we suspect will continue and will have some kind of FY '26 budget implication or proposal from staff for the board's consideration. So continuing to provide the bridge and mobile services, trying to scale those in partnership with the City of Austin and our partners at ECHO as additional permanent supportive housing units come online in the community. somewhere between 500 and 1,000 over the next 12 to 18 months, up to about 2,000 over the next 2 years. Continued partnerships with many, many partners that are working in this space, but specifically our EMS partners and how we can grow and scale some of the work that they're doing. Community care provides a significant service provision to individuals experiencing homelessness, mobile, the Careco site, Arch, and others. Integral Care's array of services we've talked about. Other City of Austin, particularly the housing departments there at the city, and our many nonprofit partners. We are starting to provide some case management support. It's kind of a predecessor to the mobile teams being on site to support some of these communities with Community First Village, Family Elder Care, and other PSH partners. And then continuing support for substance use treatment, scaling those teams as we can. And Alan mentioned the homeless navigation that could get a kickstart at CEC, but potentially doing some joint planning with the City of Austin and other partners as we design and develop the Cameron Road facility, making sure that it's not just healthcare services, but we're really creating a one-stop shop that helps address social needs through our partners as we design and build that campus out. Next slide.
This is the final slide, and it really is just building on, at a very high level, the alignment that we have been doing with the City of Austin, Austin Public Health, the Health Service, the Homeless Strategy Office, the Housing Department, Travis County, HHS, Integral Care, and ECHO, really looking at this alignment on planning. So the initiatives and programmatic proposals that John Morgan spoke about on the prior page are things that we have been talking about with all of these different organizations that we meet with sometimes on a weekly basis, at least on a monthly basis, in different venues, particularly making sure that as we align on planning, we can enhance our impact and reduce duplication, particularly looking at things like case management and finding a space for the navigation services like those that are provided by the Sunrise Church today. And then also making sure that we are aligning on how we structure our contracts. So it's not just that we're aligning on how we might do the work, but on language that's included in the contracts and on things like information we're required to share so that we all can have the appropriate data and also so that we are tracking the same kind of required elements so that we can measure the collective impact. And then also one of the recent areas that has been brought up in a meeting that's hosted by Assistant City Manager Stephanie Hayden Howard and David Gray is to align on a philanthropic approach in going together to reach out to different potential funders to support kind of a more aligned approach to addressing these needs for this community of people experiencing homelessness.
Okay, we're going to take maybe 15 minutes or so, 10 or 15 if we can, just because of our timing for today, to ask questions and see if anybody has anything they want to discuss. Before we do that, I just want to say that we'll be it's my understanding we'll be talking about the slide on proposed expansions more, of course, as you said, John, when we get into the budget, and also just for everyone's awareness. And I think, Monica, you had brought this to us before. There was a very interesting and comprehensive presentation made by the City of Austin Homeless Strategy Office to the City Council's Public Health Committee, which you shared with us, Monica, at our last meeting, shared the slide deck. If you have time and, then you could go back and listen to that because it was very interesting. And what's of note for us is that presentation from their Homeless Strategy Office looks in terms of the community's response to homelessness, talks in terms of what the city may be focusing on, talks in terms of their partners. And when they talk about partners, they speak about Central Health as well as Travis County, and other partners in the community. So, so that's just something we'll be talking about more, in terms of what our, this is a great presentation that tells us what we have been doing. And I want to thank you, Dr. Lee, for your leadership as well as our team's leadership in really stepping up to the plate on services for homeless individuals. So this shows us what we have been doing and what you guys are thinking about. And we'll talk about it a lot more as we get in our budget. But it's also, it's just very, from my perspective, it's just very encouraging that we can say to the city, look, this is what we've been doing. We're a partner with you. This is what we expect we will be doing. So we can be a partner with the city in addressing the needs. So, so I just wanted to share that with everyone so y'all know that conversations are happening with the city. I'm going to turn first to our two managers that are on virtual, and then I'll go around the room. Dr. Martin, and maybe we could take down the slide deck. Dr. Martin, is there anything that you want to ask our team here? Can't quite hear you.
Can you hear me now?
Yes. Mm-hmm.
So thank you for the presentation. It's great. It's really nice to see that. I do have one question in terms of, so we're presenting this to the city. Are we, since we have to do a county, is county aware of this work as well?
Yes, the county is aware of this work and participates in these collaborative meetings as well. I think there are typically 2 to 3 representatives of Travis County Health and Human Services Division that join these meetings.
And is the Commissioners Court aware of the work?
Commissioners Court.
I am not sure about that. I believe that they would be. I don't see Ana Almiguel here, but yeah, so that I know
Okay.
some of it we presented on things like the diversion services, but not. I don't think we presented it in this type of comprehensive manner. Dr.
Okay,
Martin.
thank you. Thank you very much.
Okay, Dr. Brinson, do you have any questions?
No, no questions.
Okay, I'm going to start on this side. Manager May, do you have anything?
Comments, maybe nothing. Maybe just a sort of a comment in a good way to further take us down the road as we plan for this work. And I know that you said this is sort of high level. I do understand that. But I'm thinking in terms of philanthropy committee and what enhancements we might be able to do down the road. So with that in mind, I would be interested in learning, and we don't have to do this here.
Okay.
But maybe you can feed us this information via email or in preparation for the philanthropy committee or something. Figure out the method, right? But I'd be interested in learning a little more. We talked about the initiative. I'm looking at slide 3, where we talk about the response that we've had for community and patient needs. And it's well lined out. I appreciate, like everybody, the information. But I'm gonna dig a little further, and while we have initiatives on there, I'm interested in going one layer down and find out more specifically what those interventions are within those initiatives. Because I'm thinking if we're gonna try to line up philanthropy, it would be good for us to know what kind of money, what are we asking for to pay, right? Money to ask to pay for what specifically, instead of in a broad level. That's kind of what I'm thinking. So like I said, you don't have to answer that question now, but be mindful that I'd like to know more about that. And then let me see what else. I'll defer to that later. And then fast forward. I like the fact that you're doing what you're doing with respect to the alignments for purposes of collecting that impact, the collection of data for impact. I think that's really good because we can use that across the board for our funders when we start, as we're doing our requests. So yeah, I think I'm gonna, that's it. I mean, I'm just sort of thinking ahead for our work, other work to be done.
Okay, Manager Jones?
Thanks very much. I enjoyed this. This is very, very helpful. I have just a couple of questions. The first one is sort of follow up on Dr. Martin's Dr. Martin's question, and that is, in the county, do we have an idea outside of the city of Austin, of the municipalities, what contribution, if any, and how they work with us, and particularly in those rural areas and some not so rural areas, to be able to address their homeless issues? Or are they deferring strictly to the district to be able to address those? And have we had the opportunity to talk to their councils or others to address that? So that's the first question. The second question is over on slide 6, I think this is. I see the medical respite building for Cameron Road is estimated to be completed, I assume, by 2025. Is that correct? Or is this just fiscal year funding for that?
No, sir, those are current year funding related to that project, so as soon as we
We'll end 2025.
are open in summer of 2025 for the CEC medical respite, which is actively, under construction, finishing those renovations, we'll then turn our attention to the design and construction of the Cameron Road facility. But we're really hoping to learn more from that CEC operation to have it inform more of what the Cameron Road work looks like. There is some work happening at Cameron Road. They're getting ahead of demolition and things of that nature so that we're ready to go. So there's work actively on the campus, but it's not going to be in 2025.
Yeah, I'm sorry, we're in 2025.
Yes, sir. Sure.
But my question goes to Colony Park. So where are we in equity in terms of opening Colony Park, given that CEC we've been looking at and Colony Park we're looking at much longer than that? And I don't know if you can answer that or if Stephanie can come and address that, but do we have a time frame on the opening of Colony Park? We've been working with the community and trying to move that date up closer to the end of 2026. I know it's a challenge, Stephanie, but if we can do these things with these other initiatives, it seems that we could put some pressure on Colony Park. So can someone speak to that, I guess?
Wait, Stephanie, come up.
Manager Jones, I would be happy to speak to it, and we are going to speak to Colony Park a little bit later in the Budget and Finance Committee meeting as well. I would like to remind the committee that, Colony Park is a new ground construction. It is a very significant size. We're looking at over 33,000 square feet. And it was something that we had to also negotiate the acquisition of the land in the city of Austin. So yes, that project has been in discussion and in development for a very long time, and I agree with you. It was a little bit different with the CEC, for example, where we have something that was already, we had to just do relatively minor renovations of a much smaller area than a new ground construction. So we are hoping to get Colony Park hopefully operational by the early spring of 2027, and we will try to do everything we can with our general contractor and other partners to accelerate that timeline.
Is there anything that the board can do to help facilitate either fund? Is there anything that the board can do either by providing resources or other things to help expedite that closer to the end of 26?
We will let you know if there are opportunities to do that. I don't think we have identified anything right now, and we are, of course, waiting for the city of Austin to put in the infrastructure of, in that area adjacent so that we have something to tie into. That is an agreement that we agreed to with the city of Austin when we acquired the property. And so that is also part of this timeline, right? We have to make sure that they put in their infrastructure, utilities, roads, et cetera. And I believe that they are in the process, and from what I understand, are on time to do that. But if there is something, we will let you know. The city has also allowed us to participate in a public project review process, which is accelerating some of that review, which is fantastic for us because, as you know, that site plan review time can be very long sometimes. And we have actually really kind of, I think we are actually ahead of schedule. I've said actually a lot. We are ahead of schedule on the Colony Park project, but I think as we get closer to breaking ground, we will know better what that timeline will look like in terms of construction. And as it, matches with what the city of Austin is doing.
My last question, a comment is that we have been meeting with the people in Colony Park for quite some time. And we had, and I think we still do have an operation at the Barbara Jordan School there.
Absolutely.
I guess my question is, is there anything we can do? I know we have a poster signed out there, but most of the activity really tends to occur closer to Decker and Loyola. So is there anything we could do about perhaps shifting that mobile site to someplace there? Because a lot of the housing folks that utilize that come from that area. I'm not saying we should, but I'm just wondering, is that a possibility? Because that is right adjacent to the new development almost. The fire station is there. Perhaps we could piggyback
Sure.
off of using the fire station.
I will work with our colleagues at Community Care. I don't want to call anybody out here, but we may have an opportunity, but unfortunately, we don't own any land, and it's not as ready available. I know Austin Energy is one of the property owners adjacent to the Decker Lake property. We could, of course, work potentially to see if there is a suitable place to house something temporarily as the full health and wellness center is developed.
Okay, then. Thank you very much.
Okay, I think you had one question that I'm not sure they had the chance to respond to yet, and y'all can respond later if you need to. And that was how the county is working with us in rural areas. Is that something you want to bring back to us, or do you know something now?
We don't, that's a fantastic question.
Okay, we'll bring that back to us. Okay, Manager Valadez.
Hi, thank you for the presentation. Let me turn on this thing. With all these partnerships, expanded partnerships with the city, with the county, with other entities that I don't know who they are, I was wondering whether or not there's a way to provide us that information. And the reason I say that is because if we're working in tandem to, let's say, the philanthropic component, raise monies together, blah, 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 I want to make sure that we have our ledgers separated so that there's no mixing of funds. I want to make sure that we don't have anybody or give anybody an opportunity to come in and check us on our following the money or not following the money because we didn't have clear policies in place. So with respect to each of the entities that we're talking about, including governmental entities and nonprofits, is there a way for you to tell us what our increased budget alignment, our allotment is going to be? What's our part? What's their part? What are they doing that we are not doing? And the reason because I don't want to see duplication of services. I don't want to see monies hidden for stuff that we have done in the past and didn't realize that had been done. Let's say Community Care was doing something for City of Austin. You never saw it, but it happened. And those were our dollars, our Central Health dollars that were expended. So I want to make sure that we're very clear on delineating and separating those dollars and what services are being paid for and what the increase is necessary to cover the shortfalls of those other agencies, because they may be looking at us as being the person that has the monies with the flexibility to provide to them when their hands are tied by the legislature. So that's more of where I'm thinking. I'm going. Also wanting to make sure that there's a way to measure the data, the accomplishments, the impacts, so that we can show that yes, we are closing these disparity gaps. We are accomplishing these things, and this is how we're doing it. We can measure it and tell you how it's being done, how much is being done, and what's the percentage of dollars that being allocated for that particular service. Just send us a copy of where the hours are for the eligibility and enrollment services offices, what their hours are, so that we can tell people. Because I have come here and they're not doing it here, and so, but you say we are doing it here, but it's only maybe one day a week or something.
Two days a week.
Okay, but it may not only be here, just everywhere.
Yes.
And we can also tell our networks that this is something especially. And one more thing, which is hard to capture, but as a result of the major downturn in patients showing up at our clinics because of fear, anxiety, and fear of retaliation, repercussion, detainment, and deportation. What are we doing at Central Health, and what are these partners doing that allegedly serve our patients to make sure that we're trying to make the deficit or the impact as small as possible? That's very important to me, because we're dealing with a very serious situation here, and I just want to make sure that we're actually looking at that with respect to how we fund other outside agencies when we know what our percentage of the MAP population is, and how much that percentage is that doesn't speak the English language, and we're concentrating on maybe other things and compensating, those numbers for the deficits that we're not getting in our population that we've had normally. So I just want to make sure that that's also a consideration. And thank you very much.
Okay. If you don't mind, I'd like to
get back to.
No, I'd like to reiterate a few things you said that I thought was really helpful. All of them, of course, but the measuring the data and the impact of our services for homelessness, perhaps when y'all come back to us and talk about next year, maybe you can give us an idea of where you're at on that. So I just wanted to reiterate that. And also...
Excuse me, one, just to tie to that, make sure that we are separating the medical and clinical supports, services that they're receiving, as opposed to the other, maybe not clinical or medical services.
like case management or something.
Yes, that's right.
Okay. Okay, I'm going to move on to Manager Rodriguez. Do you have anything?
Sure, I have two quick questions, one on slide 3 and one on slide 9. And the first one is just clarification for me. In reading the whole community needs initiatives, do you all differentiate, or is this a strategy for just adults, or is it also pediatrics, or is it both?
It is both, but the primary focus is on adults, although there are, pediatrics has been part of this. At the time we developed this in 21, 22, and 23, we were focusing primarily on the medical access program and MAP Basic population. And so there are pediatric enrollees in that, but the bulk of the population has been adults.
Thank you. I just remember my recollection of being on the school board and the thousands of children that are identified as homeless. And I know it's a different definition according to the Housing and Urban Development, but I was just wondering how it tied into what you're doing here, because obviously the school district has some great information on those individuals. On slide 9, I really appreciate the collaboration and the alignment that you have on planning, contracting, and philanthropy. I guess my question from a governance perspective is what the governance alignment is, and maybe it's an assumption, and as a new board member, or maybe it's just me as a board member, but the governance alignment is of interest to me as well, about do we have the same shared goals and outcomes with ECHO, Integral Care in Travis County and the city of Austin, or do they overlap, or what's I'll take a word we were using earlier, the healthy tension between them, because I think it's important to understand what our role is and what our resources, and then the financial pieces towards those outcomes and goals, just to make sure. I think previous managers said, I mean, it's really about transparency and accountability, about those resources not being additive and not being repetitive or replacing anything as well.
Yeah. Mm-hmm. So I don't know if you want to speak to that now, but that's a really important question, and might be something to really dig into as we talk about our budget. Because what I'm hearing is, we want to be, this is particularly important as we talk about what both of you guys have pointed to in terms of the roles of the other entities in the community and the dollars and services that they're putting towards homelessness. We want to be additive. We don't want to be just replacing, and which I think may have been part of what you were getting at, Manager Valadez. So I think that as you prepare to present to us as part of the budget, the expansion of services and the additional services, and that as you continue to talk with the city, I think that would be important, for us to understand. And so if I could, given the time, if I could just ask that we have a longer, robust conversation about that, as we talk about the budget, does that work? Mm-hmm. Does that work for you guys? Okay.
Really
All right.
helpful.
Oh, Jim.
I just like to ask a question tied to what I had asked earlier.
Okay.
Is to see what contribution, if possible, of the unhoused population are in unincorporated parts, not
Okay, good.
unincorporated
Yeah.
or are in other municipalities within Travis County.
Okay.
And what, if anything, in dollar amount, they are contributing towards addressing their needs in their community.
That's a good question.
To further delineate on that point, it's, and you may be meaning that, but to be clear, to further delineate that point is other municipalities that reside in Travis County, right? We have Travis County, and then you have other municipalities that are over in Travis County that may actually, they have their own, city governments, if you will. So, just to be clear on that.
And I think I heard some talk over here also about the school district. If we could come back and have a conversation, and I'm sure Manager Rodriguez could be helpful with that, about how that partnership is working, or if it's working, if there's opportunities there, so. Okay, thank you all very much. Appreciate this. All right, I'm now gonna go to item number 2, which I think is item number 2 in closed session? Yes, okay. Item number 2, receive an update on Central Health Facility and service needs identified in the Service Delivery Strategic Plan. I announce that the committee is convening in closed session to discuss agenda item number 2 under Texas Government Code Section 551.072, deliberation regarding real property, under Texas Government Code Section 551.071, consultation with attorney, and under Texas Government Code Section 551.085, governing board of certain providers of healthcare services. So it is May 14th, the time is 3:27, and we are going into closed session. So let us know when we're there. It's May 14th, the time is 4:27, and we are going back into open session. Managers, we're gonna close out the Strategic Planning Committee meeting. I'm sorry, what? Well, I was getting to that. We're gonna close out by first saying that item number 3 is just informational. It's an update on the Central Health Latino Family Support Conference. There's no presentation on this item. There's a memo in your backup. So So the staff should be able to answer any questions or concerns you have offline with regard to that. And let me just throw in a thank you to Manager Valadez. I know she's been working on. Yes, go ahead.
Very briefly, Shannon and other board members. So what we're experiencing from the federal level has deeply impacted what is going to happen.
Yes.
Deeply. So much so that we will be doing, I lost you on. We are going to have to do a hybrid
Okay,
summit,
okay,
Zoom and in person,
okay,
because no one's going.
okay.
They're not going to their clinics, visits, they're not going to the doctor, they're not coming here.
Okay,
So, and they're also not participating in the programs that we had set up originally for training CHWs and things like that because of fear.
thank you for bringing that to our attention. And thank you for working on this. It's very, very important. Okay, so I'll move on to item number 4, which is confirm the next strategic planning committee meeting date, time, and location. Our next strategic planning committee meeting is tentatively scheduled on Wednesday, June 11th at 1 p.m. Here at the Central Health Administrative Offices. At this time, I'm ready to accept a motion for adjournment. Motion from Manager Valadez, second from Manager Musaitiv. All in favor? Aye. Okay. We are going to adjourn, so now I will turn it over to you.
Okay, perfect, thank you. Okay, I hope you're all excited. Well, good afternoon, everyone. Today is May 14th, 2025, and it is 4:30 p.m. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Budget and Finance Committee. As a reminder, some of our committee members may be also participating by video conference. We have Dr. Brinson and Dr. Martin online. And so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. So I know we had an opportunity for public communication today during the strategic planning committee at 2:30. However, if there's any members of the public who wish to make any comments, they're more than welcome to make any at this time. Is there any public comments? No. Okay, thank you. So there are no comments at this time. We will proceed to the committee agenda. Committee agenda number 1, receive an update regarding fiscal year 2026 proposed driving forces. Members, there will be no presentations on this item. There are materials in your backup, and staff are available to answer questions offline. Staff will bring back the final presentation on this item to the May 28th Budget and Finance meeting, and the item will also be on consent agenda for the final approval Board of Managers meeting. Please submit any additional proposed driving forces by May 18th. I also have a question in terms of board recommendations. Are those due on the 23rd? Because that's the email that I saw. And do we have the template, the form? Because I could not find it. Was it a link? Oh, okay. So I will go back because, so for May 23rd, if you can submit your recommendations. And I think it will be helpful after to see the driving forces as you're aligning your recommendations as well. So that concludes agenda item number 1. Do we have any questions or discussions on that item?
Could I just make one comment? Oops.
Yes.
So two things going on here as our chair pointed out. The May 23rd deadline applies to any recommendations you want to make as a board member for the budget. So that's one thing. The second thing is the driving forces, which we will vote on our May 28th. So take a look. If it's missing anything, let us know.
Yes,
okay, thank you. I just
absolutely.
want to clarify that.
No, thank you for that clarifications. Manager Jones?
Perhaps I'm the only one, and probably is. I got them confused somewhat, in the sense that I did provide some budget recommendations. I had the opportunity, thanks to staff, to be able to meet today to go over driving forces. And I've inculcated some of those in that. So I want to make sure that the documents that you receive, are there going to be 2 documents, or can they not be incorporated into the driving forces?
So
You want to speak to?
it depends on what your comments were. Were they board recommendations that you wanted for the next fiscal year to be done, or were they comments related to the driving forces that we have aligned? In so I'm just, so they'll definitely intersect. I can see that, but maybe staff can
Yes.
help.
I think I could
Yes.
probably help too. So Manager Jones, what you submitted is being used as your recommendation for items for the budget.
Correct.
So you've already complied with that May 30, with that
23rd.
May 23rd deadline. You've already done it, okay? The driving forces is just a document for all of us to reference when we are making our own, if we want to make recommendations like you have. So you're way ahead of the rest of us.
Okay, so does that mean I do not have to submit anything on the driving forces?
No,
If you're
Is that-
happy.
Was that a yes, I do not have to, or yes, I do?
you do not have to. You
Okay.
can read them and say, oh, I think this is missing something that I wanted in there. But I think we made some changes, Perla, that already incorporated what you were looking at. Just double check us.
Okay, then, well, the staff today was very helpful in getting with Brianna and
Anissa Kendall.
Anita. They were very helpful.
Yes.
And so we inculcated those. So I think you have all that I need to do. All right, thank you.
Wonderful. And you have the latest copy of the driving forces, correct? Okay. So if you've not, we'll make sure that everyone receives it, that you review it ahead of time. And if you have an input. And they're in the backup. Thank you. Okay, any further comments on this item? I see none. Moving on to agenda item number 2. Receive and discuss amendments to the Colony Park construction budget. For this item, we will have Jeff Knodel and Stephanie McDonald will be presenting. Jeff, are you joining?
Jeff, you don't have to, but you just back me up, right, with the dollars back there? Thanks. It's all about the money.
So, board members, yes. Yeah, we did not, this is an open.
This is an open session, and we're asking for no action tonight. We just wanted it for awareness, and then I believe we will come back on the 28th and ask.
Correct. And just for everyone's awareness, this is a project, a capital project we had previously approved, but there has been changes in the landscape of environment that they are coming back to amend the budget.
Correct.
So please proceed.
Thank you. If you'll go to the first, I think I shared with you some previous renderings. If you'll take us to the next slide. This is really the front view from the building, from what they're calling Helen Miller View. If you have not met Miss Miller, she is a force. She worked for a very long time in the AISD schools and the cafeteria program, and she is just amazing. And one of the community leaders who's really advocated for a very long time for more services in this community. So this is just a rendering from the street level. Right now, because of the grade change and the kind of very tight 2.28 acres of land that we purchased from the city, we have multiple levels. This would be kind of level 1 and level 2, and the second story there is the clinical floor. If you want to go to the next slide for me. Again, this is the front where we would have a community resource room and the ground level in that kind of glass area, and then upstairs would be the waiting for the clinical services. Next slide, please. when we asked for the initial project budget, it was in 2019, and we had some data about what we thought the service needed to be. And we have gone back with our partners at Community Care and worked with them, and they are really asking for more space. This is targeted to an adult population. Again, really trying to make an investment here in a predominantly adult dental as well. I think this has really changed kind of the amount of space needed as well as the cost. Some of the other things that we know are important, there are no pharmacy services in this area. Having a drive-through pharmacy we think will be important. Again, phlebotomy services. We are currently planning in a commercial kitchen. This is really to help us serve our patients. This is not for the community as much as working on medically tailored meals, preparation for some of our other care settings where we might need a backup commercial kitchen to make sure that we are able to care for patients in our population. We do have a community resource center. This is where we have our eligibility and enrollment teams that they do financial screening appointments. We have built this very flexibly, with a lot of flexibility, hoping that, in the future we can use a space for telehealth and maybe other clinical services if possible. But right now, this is where our community health workers meet with people, make sure that we know what enrollment that they need to be scheduled for, providing access to some of our community resources like diapers, feminine hygiene products, etc. So this has really dramatically increased the amount of square feet that we need for the Colony Park Health and Wellness Center. And then also because of the topography and the constraints, we are having to create a parking deck. Otherwise, we would have had 14 parking spots for the site. As we know, we want it to be a very highly utilized site. There is not a lot of transit options in this community, and so I think we need to be prepared to have people in personal vehicles coming to the site. So if you will go to the next slide for me, Brianna, please. This is where, okay, Jeff hasn't fallen out of his chair. That's great. We asked originally, like I said, in 2019 for the 16.143 number. This is really, if you see in the construction line where the largest amount of additional funding is being requested. I think we're keeping everything else kind of very much commensurate to the size of the project. The other thing that I really do want to point out is, although we think that $4 million is a very hefty contingency number with the tariffs and the wild fluctuations, we're already getting a lot of reports from the construction manager at risk on this project that their subcontractors, skilled trades people are giving them numbers really very varied and very wild in terms of the spread. So we hope that things will settle down as we start to buy out this project. But I think right now we are, hoping that we can, this contingency is enough. But I do want to let you know that we, if the tariff scenario does become scarier, we may have to come back to the board. And with that, I would like to present the delta, which is this 21,153,000. The English major kicks in, and then we come back to the board next week to ask Budget and Finance for approval and recommendation for the full board. 2 weeks, rather, the 28th.
Okay.
And I'm happy to answer any questions.
So just a couple, thank you for that presentation. Can you outline to the managers and the public some of the challenges and why the ask is this amount? What have you encountered? I know you mentioned tariffs. So if you can just...
I think the biggest one, though, is really the fact that the size of the building, the facility, has really dramatically increased, and that is to really meet the clinical needs, including, the large dental presence, as well as more exam rooms. And the construction budget is actually it's right in line with where we are at with the Del Valle spend, for example. And this is a totally different general contractor who's provided a very similar number in terms of construction. But what we it's really just the size of the facility that's grown.
Thank you for that. And do we have
I would just also add, and I know we didn't talk a lot about that, but the initial budget was a 2019 budget. There's a lot that's happened between then and now. You've got COVID, all the inflation. So I just wanted to point out, not only was there a change in scope, increase in size, but just overall construction increase, and we've seen significant construction increases just during that period.
So in the future, when you're presenting this, especially if this is public documents, if you can just put in between parentheses, just a reminder some of the changes since, like 2019.
Okay, I think we did it in the first slide, which is why I.
Like this, whenever there's a number.
Sure,
And I think
absolutely.
we discussed it in one of our meetings. If we can just put a disclaimer, these are all estimates.
Yes,
We don't know down the road what may happen. So
Right.
if it just
absolutely.
making sure that these are estimates and you did your best. So thank you for that. I'm gonna open the floor. Does anybody have any questions related to the potential amendment? Well, it's not potential, it is going to be an amendment to the budget.
My question's real quick, and I know you all did a presentation on your, sort of like your minority contracting. You had like a presentation at some point. But anyway, not to go too far back into it, I'm just curious, who is your contractor for this project?
It's Hoare Construction.
And any chance that you know what the breakout is for purposes
I
of
don't.
other?
I will share with you, Hoare is a major general contractor, construction firm. They are doing the expansion to Del Seton Medical Center. So this is a very large-scale general contractor that is a construction manager at risk. I would have to come back with you on kind of the good faith, the HUB goals.
I would like to know what the breakdown is
Sure.
for minority contracting on
Sure.
a project of this size. I
Absolutely.
think it's important for us to know, because I think we have a policy, I thought.
Yes.
Thank you,
Create a
Manager
policy.
May. Manager Jones, yes, do you have questions?
Yes,
I'll come
just
back to you.
Thanks very much. This is very helpful and tells us what's going on in our economy today. I just have two quick questions. One is, this is for Central Health Facility, and we have talked several times about the possibility of a library being housed temporarily by the City of Austin within this. Adjacent to this property, there's also 2.5 acres of land that the city at one time had expressed an interest in. Is there the possibility that have we talked to the city about doing something where they can help defray some of this cost, since we're going to, and make that area permanent, or make it an adjacent to, connected to what we're building there?
We're very much working with the city. So remember, the city is putting in the infrastructure, and not even Catellus, now known as Arcterra, as the master developer of that 208 acre master development area. The city is actually coming in, Public Works is putting in the infrastructure adjacent to this site to serve this site. We have a cost-sharing arrangement with the city of Austin to support that infrastructure, but they are the ones who are putting that in. And then we are working collaboratively. We meet regularly with them to make sure that the south entrance of our site does connect, not necessarily, but the roads connect, the alignment, the sidewalks, et cetera, with what they are planning in that south portion that fronts Loyola. And I think a lot of that is dependent, of course, on potentially a future bond election.
Okay, all right, thanks very much.
Thank you, Manager Jones. Manager Valdez, do you have any questions? No? Okay. Do you have any questions, Manager Valdez? Your microphone, please.
Thank you, Elisa, for bringing the issue up about the minority contractors and subcontractors. Because one of the issues that I know I had raised when we first started down this minority contracting issue was growing subcontractors into contractors. And so long as we continue to go with the big boys and then allow them to subcontract, and we don't know what they're really doing when they're subcontracting, because we're not on top of that. The general contractor is. So I still want to make sure that we are keeping an eye on that and understand that I would love for us to consider minority contractors as opposed to the big boys that rely on subcontractors to fill their numbers. Thank you.
Thank you all.
Could I just make a quick comment
Yes,
on that? We are looking at monitoring all the subcontractors. That's part of our requirement. Part of, I think Margaret and Belina Bunch, our procurement director, have come to present. So we are tracking that. I think what I hear from the committee is more of a desire to report at a project level rather than a fiscal year level. So
Yes.
we'll work on bringing that detail to the committee.
And understand that my concern is when we do male and female or gender owned, that there is a distinction made between Anglo, Black, Latino, whatever other denominations or populations are owned, and not just women-owned and that's it. No, that's not the way it works. If we're gonna do the delineation for males, we're gonna do it for females. Thank you.
Okay, Chair Kitchen.
This is it for a future item. At the appropriate time when we can talk in more detail about our a minority women-owned business. I'm also curious if we've ever explored some other worker protection kinds of requirements that relate to level pay and other kinds of worker protections. I don't recall talking about that as a board, and so that's a future item that I would just like to make a note of, Dr. Lee, at the appropriate time, if we could have a conversation about that.
So, Chair Kitchen, do you think this is probably more relevant to discuss in infrastructure committee?
It might be. I'd look to our chair to infrastructure if he would like to have that conversation there, or if he'd like to have it in another committee.
I would, to me, happy to entertain the conversation in infrastructure. I think that the Budget and Finance Committee is very public-facing, and I think that this conversation warrants probably to be a public-facing conversation as it directly relates to equity and procurement.
Okay.
But that's just my thought. I defer to the chairs.
Okay, Dr. Lee, why don't we just figure out the appropriate time, and you can work with the chairs, and they'll figure out which committee.
Our committee, I'm just wondering, is
5
it
seconds, very quick.
Yes.
If you could have staff check to see whether or not we adopted that minimum wage per hour. I thought I thought we had at one point in time adopted a $15 minimum
I think we did.
living wage prior to y'all coming on.
Okay, maybe so.
So if you could just check the minutes for that.
Okay, thank you.
Okay, thank you all. Any comments? Oh,
Two real quick
Manager
things.
Rodriguez.
Thank you. When is Colony Park supposed to open its doors?
We hope in, well, right now, spring of 27.
27. In the budget amendment, the money, is it Central House money, or are you planning to use bond money, paying interest?
I
I'm just trying to think
believe-
of
Right now, it is central
Fiduciary
health money and,
responsibility. No, I'm sorry.
right now, we are in open session talking about using central health money.
Got it. Thank you.
Okay, perfect. Do we have anyone online make any comments? No. Just for the future, I don't know if you brought it back to us or not. Whenever we're changing the scope of a capital project, if that could, I don't know if you brought it back to us, that has
Yeah.
any fiscal implications?
Well, I think we did bring it back as a, as a topic. I think we weren't sure when we started. We just kind of put a placeholder in the budget and working, with Community Care and trying to develop what that program looked like. I think this is where we've ended up.
Okay. Just in case, in the future, whenever we're having any changes to the scope, that will have an impact on our finances, if you can bring it back. Thank you all. Now, we are gonna move to closed session for item number 3, receive and discuss a presentation on an overview of legislative and regulatory issues impacting Central Health. Members, this item, the public, it's gonna take about an hour for us to discuss, just for everyone to know. So I am gonna announce that the committee is convening in closed session to discuss agenda item number 3 under Texas Government Code 551.071, consultation with attorney. So, if y'all wanna take a 5-minute break to grab some food and come back, and during that time, if we can have the documents. Oh, yes, and it is May 14th, and it's 4:52 p.m. Thank you. Okay, I hear myself. Okay. Members, we are out of closed session. We discussed item number 3. There's no motion for that item. And I am ready to adjourn this meeting. So agenda item number 4, confirm the next Budget and Finance Committee meeting date, time, and location. Managers, our next Central Health Budget and Finance Committee is tentatively scheduled for Wednesday, May 28th, 2025 at 2:30 p.m.? Why is it 2:30?
Okay, don't put the time.
Yeah, at May 28th, 4 p.m.
sorry.
Yeah,
That's from the
thank you.
old script.
At the Central Health Headquarters, 1111 East Cesar Chavez, Austin, Texas. At this time, I'm ready to accept a motion for adjournment.
So moved. Second.
Chair Kitchen moves, second. Manager Valdez, all in favor? Aye. We're adjourned. Thank you.
Okay, managers, we're going to move on to our last meeting, which will be about 30 minutes, that's all. Okay. Good afternoon, or evening. Today is May 14th, and it is 6:33. As a quorum of the board is in attendance, I'd like to call to order the meeting of the Central Health Board of Managers. As a reminder, we have 2 board members, Dr. Martin and Dr. Brinson, participating by video conference. We will proceed to the regular agenda. Members, we're not going to take up item 2 tonight regarding the HR policy. It'll be brought back on May 28th. We need some more time to work with our staff on that, but that'll come back on the 28th. So I'm going to go to item number 1. Discuss and take appropriate action on the appointment, employment, evaluation, reassignment, duties, discipline, any agreements with or dismissal of one or more Central Health employees, including the CEO of Central Texas Community Health Centers, DBA Community Care. And we are going to go into closed session for this item. Let's see. I announce that the board is convening in closed session to discuss item number 1 under Texas Government Code Section 551.074, personnel matters, and under Texas Government Code Section 551.071, consultation with attorney. So it is 6:34 on May 14th, and we're going into closed session. We ready? Okay. It is May 14th. The time is 7:14, and we are entering open session. Members, I'm going to take a motion related to item number 1. Okay, I move that we or do you know what it is? No, you can do it. Go ahead.
I move that the board delegate to the Central Health President and CEO the authority to negotiate and agree to a possible settlement of claims within the range as discussed in the closed session.
Within the range and the terms.
May I just repeat the motion?
Yeah.
I move that the board delegate to the Central Health President and CEO the authority to negotiate and agree to a possible settlement of claims within the range and the terms as discussed in the closed session.
Okay, do I have a second?
Second.
Second, Manager May. All in favor?
Aye.
Aye.
Is that, okay, any opposed? Okay, we have 2 opposed, okay. Dr. Martin, did you vote?
Yes, I voted yay.
And Dr. Brinson? Can she vote?
Yes, I voted yay.
Okay.
But if I can't vote, I get.
You have to be on camera to vote, but,
Oh, okay, sorry.
okay. All right. So the motion passes. Let's see. So I'm now moving to the last item, which is confirm the next regular board meeting date, time, and location. Our next Central Health Board of Managers meeting is scheduled for Wednesday, May 28th at 4 o'clock, I believe, at the Central Health Headquarters here at Cesar Chavez. At this time, I'm ready to accept a motion for adjournment from Manager Valadez, seconded from Manager May. All in favor?
Aye.
All right.